All right, we are live. Hey, everybody. Welcome to Big Barker's second annual Arthritis Awareness Week. My name is Eric Shannon. I'm the founder of Big Barker Dog Beds, and we're here with our good friend, Dr. Hannah Capon. And we're ready to kick off a whole week's worth of expert veterinarians who are going to share topics and tips that'll help extend the happy and healthy portion of your dog's life for as long as possible. Dr. Capon is a winner of the Impact Award from the Royal College of Veterinary Surgeons, and she's also the founder of CAM, which is Canine Arthritis Management. She dedicates her entire life to fighting against what many of us believe is the most serious health problem facing big dogs. So what I'd like to start with, Hannah, is a video that you created a couple years ago that'll show exactly to everybody why we are here this week.
Perfect.
How can I be of help? Can you describe how you're feeling to me? Okay, can you show me? Can you point to where the problem is? I'm afraid I can't help if you don't tell me. Stop. You're in pain.
Tell us about that video, Hannah.
I haven't seen that for a while, and it still hits a little bit hard.
Yeah, tell everybody what's going on there. What's that really about?
So basically, that's my dog. Sadly, she's not with us anymore, and she was my steepest learning curve about how much discomfort a dog will tolerate, will cope with, without telling you. They just get on, and I think what that film's really trying to convey is that we need to listen, we need to observe, we need to be their advocates, because they're not going to come in yelping, they're not going to come in going, ah, ah, ah. We've got to look for the change, and it's pretty inevitable. You know, I'd say nearly all dogs are going to get arthritis. Some are going to be unlucky to get them a lot earlier than others. And it's our duty of care to look after our best mates.
So the stat in that video is that 80% of dogs are going to get arthritis by the time they're 8 and older. Why doesn't everybody know this? Because it's something that I didn't know until I, was involved in the industry and my own dog started getting his problems with hip dysplasia and arthritis. But why isn't this talked about as much as some other health problems?
It's really difficult because I'm the same. I've been a vet for 20 years now, and I got obsessed 7-8 years ago, and I don't think the penny had dropped. I hadn't connected the diseases that we get taught and we see regularly, and actually they lead to arthritis, and arthritis is the leading cause of euthanasia. And I think the dots just haven't been joined. And one of the reasons is likely to be is because arthritis is so common in the human sector that we don't die of it. You know, we cope with it, we live with it. And it was really drummed home to me. I was in a car with a guy called Sean, and I said, well, you know, arthritis is the leading cause of elective euthanasia. And he went, arthritis kills? And I was like, yeah, it does. Yeah, it does. And I think people just don't connect the two. And luckily, in the last few years, it's getting a lot more attention. Over here in the UK, we have something called Vet Compass, which looks into what's happening in our practices, our first opinion practices. And it's now been labelled a welfare concern because it's the thing that we see most commonly, the longest suffering and the worst pain. So bring all those things together. This is a worry. We need to do more about it. So it's getting a lot more attention now. The figures of 80% over 8, I don't think it does that disease justice, because you know very well with your dog that he started suffering a lot earlier than that.
Mm-hmm.
And the figures suggest that 50% of cases are not diagnosed until they're over 8 years old, when actually the leading cause of arthritis is developmental joint disease, which they're going to have from 3, 4, 5 months old. So there is a big gap there where a lot of dogs are not getting identified and diagnosed.
So Hannah, you said it was 7, 8 years ago that you really focused on this problem. So why are you so focused on arthritis and bringing more attention to it?
Guilt. Terrible guilt. So I've been a vet for about 11, 12 years when my penny dropped. And I think I was just a bit gobsmacked that I hadn't put the 2 dots together. So I was working in a practice in Brighton, and in the diary, it said gone off back legs. So the dog was brought in and everything else was working. Heart was good, eyes were bright, everything else was working, but there was no muscle mass on those back legs. And I was like, wait a minute, there's not many things that can do this. This dog didn't go off its back legs overnight. This is months, if not years, of uncontrolled pain, causing them to use the legs less. So therefore they wither, become weaker, become less useful. It didn't just happen once that afternoon, back to back, 2 in a row. And that just made me think, you know, we've got to be doing more about this, because these owners loved their dogs. It wasn't that they were negligent. It wasn't that they didn't care. They cared a lot. They just didn't know. So at that point, I started my journey of trying to make people more aware of what a problem this is and how much more we can do about it.
You mentioned that it was the biggest cause of elective euthanasia and that people are often surprised to hear that. Why is it the biggest cause?
Okay, so the prevalence is just such a common disease, and it doesn't matter what breed you've got, they are very unlikely to avoid arthritis. And it doesn't shut down their system. So it's not going to be like heart disease or lung disease or liver disease. This is something that causes significant pain, significant stress, but it doesn't stop a vital organ. So that means that we have to make the decision. We have to decide when is enough. So yes, it's very prevalent, and unfortunately we're their advocates at that point.
And it is so difficult. I mean, my dog Hank, he was diagnosed with hip dysplasia as a puppy, but it didn't really seem to affect him until he got to be 7, 8 years old. And you're right, it's not an organ shutting down. It's not something where you go to the vet and they say, you need to do something now. It's just a slow progression, and it gets, you see it develop over the years, to where for me, it was the first time I noticed that he was changing is we used to walk past this park every day, and there was this brick ledge, and he used to like just going from the sidewalk from a standing still position to just jumping up on top of this ledge. And he loved doing it. I don't know why he did that all the time. But then one day he did it, and like he didn't quite make it. His feet kind of clipped the surface, and then he never made that jump again. And then from there, it was these small incidents over time. So it is such a silent thing. He wasn't crying in pain. He wasn't even limping until he got to be older, and that was sporadic as well. So it is really, really a tough thing. Now, one thing that you've talked about many times in the past is that there's some simple things you can do at home. So I'd like to talk about that for a minute. And then we'll get into, like, we'll give everybody sort of the agenda for the week after this.
The week's going to be amazing.
So let's give everybody something simple, like 3 simple things that anybody can do at home right now to protect our dogs from arthritis.
Okay, so let's just clarify this. Unfortunately, there's no way in the world that if they've got developmental joint disease, we can prevent it, but we can certainly try and slow the development and slow the progression. And we can also avoid traumatic causes of arthritis. So if the joint gets damaged because of accidents and stuff. So 3 areas that we can do in the home. I definitely start with weight control. I know that's it's like, well, that's not in the house, but thinking about it, if we keep our dogs lean from a very, very young age, we're going to reduce those forces placed on those joints, which is going to progress this disease. So weight control, weight control, weight control. And if you don't know how to check whether your dog is the right weight, we'll talk about body condition scoring later. Next, flooring. Now, there isn't a huge amount of evidence out there in the animal world about what effect our flooring is going to have on our dogs, but it's pretty logical. If you've got a dog that's slip sliding around consistently, they are going to damage themselves. Our joints really rely on the muscles, ligaments, and tendons that sit around them to keep them stable. And if they're stable, they're safe, they're happy. If they start becoming unstable and start doing weird movements, they're more likely to become arthritic. So if we start damaging all of that soft tissue, those muscles, those ligaments, those tendons with slips, trips, falls, stumbles, slides, you're going to unstabilize those joints and you're going to encourage the onset or the progression of arthritis. So flooring, flooring, flooring. Next one, it's got to be our attitude to them jumping on and off things, doing stairs, in and out the back of the car, jumping on and off the sofa. I went to someone's house the other day and their dog did the wall of death on a probably about 10-time daily basis. Leather sofa, laminate floor, pretty much hit the coffee counter, back on the leather sofa, back on the leather sofa, hit the wall, back on the, and you're like, wow. And the owner was like, isn't he having a great time? I was like, oh my God, no, that's going to lead to injury. You know, it looks fun at the time, but that's basically putting your young kid on an ice rink and just going, go for it, see what's going to happen. So I definitely say be really conscious about getting on and off sofas, stairs, coffee tables, breakfast bars, whatever it is, inside and outside the house. So those 3 things would be really big on my list.
So about flooring, people generally love hardwood floors. They look great. What is like a healthy compromise? If you have hardwood floors or laminate floors, what can you do to sort of strike a good balance?
I do rugs. Personally, there are many, many options that we can put on their feet. There are different things that we can use to give them grip, but they're costly. You have to keep replacing them. They can come with complications. And actually, the easiest thing is just put some rugs down. So rubber-backed rugs. And a key place that I would always have rugs are around the front door where they go and greet people, in the kitchen, especially where you're feeding them, and around on their bed. Because the bed is where they are going to be most vulnerable in the morning. So having laid down for long periods of time, they're going to wake up and be stiff. So getting onto that flooring is going to be seriously treacherous. So put your rugs around the bed as well.
And carpet treads too.
Yeah, you call it carpet treads. We call them runners.
Runners, okay. Yeah, we got some really easy things that we got online. It's just they kind of like stick onto the wooden things super tight, and it makes it just so much easier to get some traction for
definitely. You can just take them outside, you can brush them off, you can hose them down. There's so much choice out there now, and I just think it's cost effective, it's cheap. And I say something pretty harsh to a lot of my owners is that you will get used to the sight of a rug, you don't get used to losing your dog. So a lot of people say, oh, I've just put that flooring down. You're like, well, just shop around and find something that fits.
Right. And then the other thing too, don't forget dog beds.
Exactly. And I was just alluding to it. We forget how important that zone is. And later in this week, we've got Dr. Amber Batson coming to join us, who's going to teach us all about the importance of sleep and how sleep can make pain worse and how pain can make sleep worse. And one of the big things to incorporate into a plan is a good bed. Something's going to keep them comfortable. It's going to allow them to get good quality of sleep, and it's going to hopefully leave them feeling less painful. So when they get up in the morning, they're not super stiff and take ages to warm up. They've got a head start.
Right. And, everybody watching this is probably familiar with Big Barker. So you probably know this already, but just to repeat, not all dog beds are created equal. You want a dog bed that feels more like a mattress, that when you lay on it, it feels like, oh, this is comfortable. You don't want a bed that your dog is going to just sink right through to the floor. But yeah, there's a clinical study on Big Barker that shows how a real bed like the one we make has positive impacts on pain reduction, improvements to mobility, better rest, all sorts of things. So a bed really is, whether it's a Big Barker or something like a Big Barker, it's
just a great investment.
It's something you just get once, put on your floor, and it has a lasting.
Absolutely. And just to butt in, when you actually look at what we do with human management of arthritis, we have what's called NICE guidelines, National Institute of Clinical Excellence. And you go down the list of interventions, and the first things is lifestyle, education, manage yourself, change your exercise, get a good bed, stop wearing high heels, get rid of the sports car, get something that's a little bit more comfortable. Think about all the things that you can do that are non-medicinal, non-therapeutic, because they don't come with side effects. They don't come with adverse reactions. They're a one-off payment. They're sorted. So take advantage of that.
So Hannah, let's wrap up we have some questions in the comments, so we're gonna come to them at the end. But let's wrap up this portion by telling everybody what is our mission for the week here. What's coming up next?
Well, partly I'm going to bring my friends to come and talk to you guys, so I'm really excited. On my journey in the world of arthritis, I met some awesome people. So we've got 4 guests this week. We've got Amber Batson talking about the importance of sleep. We've got Kathy Mercy talking about the neuroscience of ball throwing, believe it or not. We've got the amazing Matt Brunke talking about how important rehabilitation is in managing chronic pain and arthritis. And then we've got awesome Cecilia Villaverde, who's going to be talking to us about nutrition fact from fiction. So the idea of the week is to really tantalize people, to raise awareness, because I want arthritis to go from being a neglected, boring disease to, oh my God, there's a lot we can do. This is a sexy disease that we have the ability to really improve dogs' lives.
And the reason that we're presenting this as Big Barker is, we make dog beds, and we're not an arthritis education company, but a lot of people that buy Big Barker beds are doing so because they have a dog with arthritis and they're trying to do something positive for them. So any information we can provide that helps you help your dog is really, really important to us. And then the other people that buy Big Barker beds are interested in Big Barker. Their dog might not have health problems yet, or their dog might be slowing down. They haven't connected the dots. So if this week can help further people's education of how they can help their dog in the best possible way, that's why we're doing this.
100%. And I think awareness and early identification is just the best thing that you could do. And as Eric was saying, if you start seeing things, you go, wait, he's not doing that anymore, or he's doing something different. Behavior change is our first clue. So we need to be talking about it, and we need to be giving owners the confidence to talk to their vet about it. Because I know a lot of people come to me as a vet and they go, oh, he does this, but I don't think it's a problem. And I'm like, no, tell me about it, because it could be. And I want you to have the confidence to go to your vet and talk about these things.
All right, we got a couple of comments and questions here, Hannah. So let's see what we got. So here's Vicky Branson. Is there anything that pet owners can do to prevent arthritis on our dogs once they hit the 8-year mark? My dog is 7 right now.
Okay, so arthritis isn't just like a light switch. Unfortunately, if they are developing arthritis, they're going to be developing it over years. So the major cause of arthritis in dogs is it's secondary to developmental joint disease, hip dysplasia, elbow dysplasia, osteochondrosis, patellar luxation. All of these are joint diseases that they're born with. And they're not just one kind of joint disease. There's a huge spectrum. You can have very, very mild hip dysplasia that doesn't turn into a big problem, or you can have serious hip dysplasia, which can turn into an early problem. So it's not like they hit 8 years old and it switches on. It's generally a slow progression. So the most important thing you can do is, as I just said, be really, really observant for clues. And the clues are going to be behavioral change, capability change, posture change. So having the confidence to say, how does my dog look? How are they behaving? Are they comfortable? Is probably the most important. In the background, weight control throughout their life is so, so important. We know it's a leading cause of osteoarthritis, early development, progression, and pain. So keeping your dog super, super trim is an absolute paramount.
All right, this is a big one, so it's covering half of our faces here. I'll just read it real quick. Brittany Dale says, one of my Danes just developed an ulcer after her surgery and being put back on, how do you pronounce this?
So it's Galliprant.
Yes. Curious how well this one's worked. Meloxicam has always worked great for my other arthritic games, but I'm terrified to put her back on it even after ulcer is healed. How do you feel about that?
So meloxicam is what's called a non-steroidal. It's what they call as a COX-2 specific non-steroidal. And we know that if one of them has caused gut upset, it doesn't mean all the others will. So first, remember, meloxicam's cousins might not cause the same. So, and that is proven in the literature, okay? Galliprant works in a different location to meloxicam. So if we had what's called the inflammatory cascade, all of these inflammatory mediators are being created. Meloxicam works quite high up, so it blocks quite a lot of inflammatory mediators. And some of these have good roles and some of them have bad roles, but it blocks quite a lot of them. Galliprant works all the way down at the bottom on a receptor. So therefore, it's less likely to have side effects because it's not getting rid of the good inflammatory mediators. It's working on one receptor that is focused on the pain of OA. So it's very, very specific. Problem with it is it as effective as a non-steroidal? So a non-steroidal has a big block effect. Galliprant's a very specific effect. And what we've seen is that it might take longer to kick in. It might not be as effective as the non-steroidal. But with regards to safety profile, it's got a very high safety profile. So it's certainly something to try. Certainly thinking about, 3, 6, 12 weeks. Use a pain indicator chart, see if it is improving pain state, and then have a chat with your vet. But don't be scared of others, because we do know that what one non-steroidal might be associated with doesn't apply to all the others. They're very individualistic.
All right, thank you. So we have some here that are kind of similar. Let's go with, so Crystal Ferris, is there anything that you can do to help prevent it, or is it just born into certain dogs? Given my Shepherd's glucosamine since he was a puppy and he still developed arthritis along with hip dysplasia by age 3. So this is kind of similar to a previous question. What I'd like to focus on is the part up top. Is it just born into certain dogs?
Okay, so yes, many breeds are predisposed to different conditions, and those conditions have a wide spectrum. So you can have very mild hip dysplasia through to very severe hip dysplasia. Hip dysplasia is the ball and socket. So you can have it very mild, where it's just slightly not the perfect fit, or you could have really severe, where the hip and ball joint. So when somebody tells you that your dog has got hip dysplasia, there's still a very big range of presentations. So yes, they're genetically predisposed, but we can influence it. So we can certainly influence it with weight control, lifestyle. We can encourage the joint stability. So let me explain that again. I talked about earlier how muscles, tendons, and ligaments create joint stability. And joint stability slows arthritis progression. If we have an unstable joint, we're going to have inflammation, arthritis. So if we can strengthen the muscles, ligaments, tendons around that joint and stabilize it, we're going to slow the progression. So that's where things like physio, controlled exercise, hydrotherapy hugely important. So weight control, early identification, lifestyle adaptations, introducing therapies such as hydro, etc. Now, you talked about glucosamine. The jury is still very out on that. There's studies that say, yeah, it could help. And there are equal amount of studies that say, nah, no proof. If you're going to use it early. So you're right to have started your dog on it earlier. But that still doesn't outweigh weight control, lifestyle, exercise modification, physiotherapy, hydrotherapy, etc. So yeah, do not rely on the orals. Think about the bigger picture.
So Jennifer Jackson's asking, so she has a puppy that just turned 1, did a DNA, and it said something about his spinal cord. So is there anything, would you pretty much relay the previous answer? Or is there anything additional you would add to that specific to the spinal cord at such a young age?
I'm wondering if she's talking about degenerative myelopathy. So that's very different to arthritis. So degenerative myelopathy is a degeneration of the spinal cord. It's not a painful condition, but it causes weakness and what we call neurological deficits in the back legs. So they get weaker and they eventually lose the use of them. That is picked up with a DNA test, but they can have a positive and it doesn't become a problem, but they can also get the disease and have a normal DNA test. So it's not 100% proof. But what I certainly would be doing is speaking to your vet and saying, well, how do we pick up on the early signs if it is going to happen? So how do we detect very early? And it'll be neurological tests, like how good is their withdrawal when you pinch their toe? If you put them on their knuckles, do they correct it immediately? Is the muscle mass solid? Are they still capable? How can I pick up on it early so that I can act on it?
Okay, thanks. All right, so there's a couple comments in here that I just want to call some attention to. So Kenzie Lang says, thanks for presenting on our
Kenzie, I know this person.
Okay, well, she's learned a lot from Cam, and she's working towards a big barker for her girl, Libby. And then we have, this is another cover in our head. So Carola says, thanks for starting Cam. All her clients go home with a Cam card. So she says, thank you to you and all your Cam ambassadors.
Good stuff.
And let's see, what else? A bunch of comments here. Here's Alice. I've had a big barker for a 75-pound German Shepherd. I also have a 75-pound German Shepherd named Spike. He's 2 now. Maybe I'll bring him on if he comes up here later in the week. But now 12 has acquired arthritis in her left hip. When I see her laying on her big barker bed, she just looks so comfortable. She's all stretched out and just relaxed. It was worth it to purchase a big barker. And that was always touching to me too. Just when Hank got older and was having trouble, just seeing him like laying on his bed and you could tell he was comfortable. You just get this feeling like, wow, I was finally able to do something for you, because they do so much for you your whole life. Like they're always by their side. And even when they're in pain, they're trying their best to keep up with you because they don't want to let you down. So the few times that you can do something tangible to help them feels really, really good.
I agree.
So thanks for sharing that, Alice. So, all right, Hannah, let's wrap up here. We've been on for about half an hour now, and we will be back tomorrow. For everybody watching, there's also a link in the comments. So we are doing a big giveaway every single day. We'll announce the winners via email, but there's a link at the top of the comments. If you want to go there and pop in your email address, we'll let you know when the next presentations are coming up. We'll send you the recordings, and you'll also get a chance to win a big barker bed and a lot of other cool stuff too. So Hannah, thank you very much for being here. I will see you and everybody else tomorrow.
See you tomorrow.
Have a good day.